Thank you, Toby. Thank you, SMSNA, for the opportunity to talk to you guys today. To be fair, it's really like an honor for me. So I know there's only 20 people in the room, but it still is. So I called this lecture The State of the State. I thought I might try to give you guys a bit of a bird's eye view of prosthetic urology rather than a deep scientific talk, more from the economic side, the opportunity. I have no grants, but I am on the Speakers Bureau for Boston Scientific, and I also am a consultant for Boston Scientific. I have no equity ownerships. My objectives today are to review the current state of prosthetic in the United States, the opportunity that is at hand for all of us that are in prosthetics and challenges that we may face, but ultimately to provide optimism and show you that there is an opportunity and optimism for success in the future in this area. And ultimately, as the president of SUPS, I hope to talk to you a little bit about SUPS and give you an idea of what its initiatives are today, as many of you may not be aware of all we've been doing. So the current state of prosthetic urology, it's good, really good. It's actually maybe one of the best times to be in this space, and the opportunity it may actually be the greatest that it has ever been in the history of prosthetic urology. As you may know, there's a variety of different products that we have out there that we consider prosthetics, ranging from inflatable implants to malleables, to artificial sphincters, to ProAct recently, testicular implants. Generally speaking, they all really have very good high patient satisfaction rates. They have relatively low infection rates, low risks of mechanical failures, and they're absolutely life-changing transformational procedures for the people who get them. So it's successful, wonderful treatment options that we have at hand. And today, for the sake of the discussion, most of what I'll be talking about will really focus on penile implants in the form of inflatable implants, as they're sort of the largest market share, and they're the thing that drives prosthetic urology the greatest. The current state of affairs is that we have very favorable economics. As you might be aware, of course, the Massachusetts aging study is, kind of predicting somewhere in the order of 30 to 40 million American males having ED, and maybe 50 some odd percent of them have moderate to severe ED, and ultimately we have this aging population with baby boomers moving into their pocket as they age, and clearly they have comorbidities, and these are the risk factors for ED. So the growth of ED patients that are going to become eligible in the prosthetic urology space is awesome. It's just going to continue to grow. 10.3 million men were diagnosed with ED in 2022 from a simple registry, and ultimately that number is probably going to double and triple over the years. The favorable economics, as many of you know, RVUs for prosthetics are actually really good. If you do a penile implant, it's about 14.19 RVUs. If you're doing revision work, it may be slightly higher. Most importantly, so we have competitive work RVUs. We have downstream revenue that comes off of any prosthetic patient. And more importantly, as we evolve into the space and become busier and more effective leaders, we sometimes are fortunate to have cash pay type patients, which are extremely lucrative. But the bottom line in all of it is that prosthetic urologists are high revenue producers. They are uniquely favorable for academic and or private practice opportunities. We're sometimes the highest earners in the space. So it lends itself to an initiative to want to be part of that space. So it's a call to action to say economics are really good. If you look at Medicare reimbursements for inpatient, outpatient hospital, you're going to find out that reimbursements are on the rise and have been on the rise for years. We're talking about going from, approximately a 20% rise in inpatient and 17% rise in, sorry, the other way around. No, I had it right. Inpatient, outpatient, 20%, 17%. The bottom line is that the Medicare reimbursements have always been on the rise, and it's favorable to hospitals. And if you look at what the margins are and you actually break down how prosthetic urologists do in the operating room, you're going to find that they have margins that are on the order of orthopedic cases like total knee replacements. So you can look at like a greater than, on the order of $10,000 margins because of the mixture of commercial and Medicare as being such a favorable relationship, C codes that, or device codes that come in that offer onerous reimbursements to the hospital. So my point in all of it is that you have financial clout. You as a prosthetic urologist are like a orthopod, with doing knee replacements in community. So you have the opportunity to use that power to negotiate block time for yourself, to get marketing dollars for your service line, to develop your service. So it's really important to recognize this. I'm not sure if people really are aware of it. If you're in a surgery center, you're lucrative. They'll want your cases, and if you ask them to run a report, it'll show it to them, and they'll give you more time for sure. The opportunity at large, it is a massive opportunity. As many of you probably are aware, there's a very large percentage of men, 1.7 million men, that are eligible for penile implants, but only 1.3% get done. So there's this huge discrepancy between men that could get implants and men that actually receive the implants. And so therein lies an awesome opportunity for fellows and or graduating urologists to embrace, or even people who are in private practice who want to develop a service line. Prosthetic urologists are relatively rare. Unfortunately, only a small percentage of all the urologists are doing the majority of the cases. So 1% of urologists perform 50% of the cases, and unfortunately we have a urology shortage. Most of us are aware of that. Certainly for every one new urologist, there's an estimated 10 urologists that are in retirement age moving out. And so you can see it in call schedules all across the country. ERs are going short. Urology has a shortage. But there's this unique opportunity within prosthetics for sure to embrace this enormous population that we need to take care of and offer solutions that are highly effective. So erectile dysfunction has its, getting from the 1.7 million out there down and only doing 23,000 a year, there are the challenges that we have. There's a 6.2-year journey that we've all been accustomed to, where from the time that people embark upon pill therapy, PD5 therapy, all the way to getting an implant, it takes sometimes 6.2 years to get there. There's other barriers that are in our way and reasons why we're having such a low treatment volume. We have, this slide is just to show you that there's several factors: lack of information, that there's a knowledge gap sometimes between referring physicians, and that there's, again, a shortage of prosthetic urologists. So we have this large opportunity with 1.7 million, but only doing 23 cases per year. The point of this talk is there's optimism. This is, even though we have some barriers and some challenges, I might argue that we are at an inflection point in the business of the cycle of the IPP, whereby the IPP is beginning to normalize, transitioning to a trusted reflex option for patients when pills, injections, or shockwaves fail. So imagine the idea, what is normalizing? The IPP is normalizing and suddenly maybe starting to become a reflex option for the first time in the history of prosthetic urology. What do I mean by that? Think about what I had to give some thought, like what does it mean to normalize a product? But products start out being launched, right? Product comes out, it has its resistance. In the early 70s, F. Brantley Scott had a lot of resistance, and ultimately there's product innovation to kind of figure out what's wrong with the product and how to make it better and evolve it to a point where there's increased efficacy and lower complications, to a point where there's physician acceptance, where physicians finally get to a place where they feel like doing the product and using it to solve problems, to a point where industry and then physician leadership begins to engage and starts to educate and raise awareness. And eventually, after years of working through this, standing on the backs of many people in this field, we finally come to a place, and I think this is happening right now, that we are having patient acceptance and trust in a prosthetic solution for their ED. And I think, years ago, that would probably be not the case. And the journey was long, and it was much more difficult to get people to engage. And I think it's changing now for a lot of reasons, and I hope to talk a little bit about that. What are the signs of normalization? What do I see in my clinics? There is a shorter patient journey. Patients are coming in today with the use of the internet and digital marketing and social media marketing, patients are presenting educated, and they're ready to proceed when they present. They come to you saying that they researched you and they know who you are, and they're here to actually have the penile implant as their solution. And I think that many busy urologists, maybe your top, percentage, high volume implanters probably experience this, but I have a feeling as we get along, as long as you represent yourself to the community properly, this is how it's going to be going more and more in the future. So that's why I say the opportunity for success in prosthetic urology may be the greatest that it has ever been in the history of this field. What will be the drivers of success in the future as we move forwards? I think it's going to be more of the same. I think we have to continue to simply raise awareness, educate, demystify. And I think the way that we crack the code is direct-to-consumer marketing. I think that's what we have found really works to raise awareness about our solutions. And it'll take physician leadership. And if I had to make one point about what's necessary to be successful is that you need digital image. You need a digital image out there in 2025 that is generally search engine optimized and has organic content to maintain it. And if you have that and you have dedication to this field, you're going to be successful and drive volumes of prosthetic urology that no one's seen before. So I think that's just empowering you guys to say, embrace it, it's here. Industry marketing support is really important as well. That's always been there, but I maybe just raise the question not to discuss it because it would be a whole talk in itself, but what will be the role of AI in all this future development? And I had some of my first patients say that they searched ChatGPT and asked for who was the best guy in Phoenix, and my name came up. So pretty cool that that's starting to pull from all website, from all different variables and synthesize an answer that says these are the top 3 guys in Phoenix that you want to go see. So ever more important to have your digital image, your presence on the web, organic content, because AI is going to pull on all of it. And AI, of course, will have other things that it can offer. I mean, it can certainly create strategic marketing, and it might be awesome for educational purposes for patients and doctors, and it will definitely have clinical applications. I'd be totally amiss if I did not mention the HARD series. The HARD series was done by Boston Scientific, but it was basically an educational documentary, a 5-part video documentary series that takes a deep dive into the emotional and psychological impact that ED has on men and on couples, and it interviews doctors and patients and brings them through an experience from multiple perspectives in a way that has never been done before. And this kind of direct-to-consumer marketing is revolutionary. I mean, I may argue, without knowing all the exact statistics that they'll let me have, that this piece may have been partly responsible for a transition into the normalization of the IPP. We're at its infancy, but it's here now. We're at that inflection point. And statistics are that there's just an enormous amount of hits to these sites, and they call to action, and they're causing people to they're driving people to look more into the solution. And then, like I said, people are presenting to your offices fully informed and ready to proceed. Optimism for the future. There are so many things that are going on in prosthetic urology. I just thought it would be good to pick 1 or 2 things that I think are really predominant in the field, and one of which, to me, I think will be a game changer would be the electronic or eIPP. I think it would be absolutely revolutionizing the user experiencing to have your sexual function in your palm of your hand, no pun intended, with an app on a mobile device. It's currently under development, but I think this would be revolutionary in terms of people who may never have considered to offer themselves such a solution might just have it because it'll be so cool. But to think that we could have this, it'll eliminate the scrotal pump, it'll create remote control access for your penile implant, and ultimately it'll be an awesome source of data collection for how we use the implant and other things. Another thing that came to my mind just through lectures and learning about things that might be game changers, a little bit about my relationship with Steve Wilson, who's very involved in this. Conti Reflex kind of brought some attention to the fact that the AUS has been out there for a lot of years and there haven't been a lot of innovations, but he spends a lot of time working and researching in this area, and this may be a potential game changer in just the simple sense that we may have an opportunity to have a double balloon PRB that accommodates for increases in abdominal pressure when we're moving around and doing different things, and that would be kind of bringing people to a drier state, and then a more flexible, easier deactivation process that might allow for people to get in and get out of activation so that they may have longer better time to failure, more mechanical reliability and less erosions, and maybe more versatility in the sizes that they offer. So I thought this was another example, something within the AUS space that may also be very revolutionary if and when it comes out and how it comes out. The last part of my talk, I really wanted to, as the president of SUPS over the past year, I wanted to introduce you to it again. People probably aware that this is the Society for Urologic Prosthetic Surgeons. It was founded by Steve Wilson somewhere in 2005, 2006, really to be a surgical society only. In other words, SMSNA is a broad-based society and covers such a large range of things in sexual medicine, whereas SUPS is really a surgical society. Its mission is simply to educate, establish best surgical practices, research, create a forum for free exchange and discussion of new ideas, thoughts, concepts in the field. It's a professional network in essence, but it forces us to work together and essentially do good for the field of prosthetic urology, help it advance. The members clearly are the best prosthetic urologists in the world. If you're not in this list down at the bottom, it's not because I didn't like you, it's just because I ran out of spot on my slide. But people like Steve Wilson and Mulcahy and Carson and Perito and Ralph Carrion and Gerard Henry and Ed Cartman and Melissa Kaufman, and the list would go on to be the ultimate list of all the best prosthetic urologists in the world. And so it's a neat network to be part of, and I'm proud to be part of it. Traditional initiatives for SUPS has always just been a collaborative course with SMSNA to do cadaver labs and didactic course for residents, and we've always been involved in research in various ways. But going forward in the future, we have an idea and something that we'd like to put forth, and we're pretty close to launching, is something called the Fellows of Genitourinary Prosthetic Surgery. And what that's very similar to is, let's say, the Fellow of American College of Surgeons. So it would be a prestigious distinction offered by SUPS to acknowledge excellence in the field. And I think what we all thought was that this would be really good for patients to help identify people who are dedicated to the field and do awesome work with high success. And at the same time, it would also be good for industry to identify those people who are committed and interested in obtaining that kind of status. We plan to roll out the program hopefully soon, maybe by August or September of 25. I think if and when we get this together, we would like to publish the criteria and let people know about the eligibility and how to become part of it. There would be an emeritus status for senior members who have achieved excellence in the field from any organization. We would probably be interested in allowing that to be part of SUPS. And so ultimately, we encourage leaders in the field to become part of SUPS because they could apply for FGPS and become a fellow of prosthetic surgeons. I'm in the process of trying to develop an app. I'd like to try to figure out a way to create value add for SUPS and for the entire network of prosthetic urologists so that we have it in the palm of our hands. I think it would be an awesome opportunity to do community building, easy direct communications with members, knowledge sharing in the form of blogs, forums, articles, discussions, similar to what you see in SMSNA, but maybe in your palm of your hand. And it has opportunity for so many other things. It could be a case tracker for outcomes data. It can become other things that we can work together on. But at the base level, we'll get an app together that once you become part of SUPS, you then gain instant access to it all. We're expanding prosthetic urology to not just include penile implants and male slings and artificial sphincters, but maybe to include neuromodulation and adjustable balloons like ProAct for stress urinary incontinence, because they're implants and we think we should be inclusive of all that. So we've expanded that, and when we have our national our meeting in Vegas every year, summit meeting, we invite these members of industry to participate so we can collaborate. Certainly, if you're someone who does a lot of sacral neuromodulation or a lot of ProAct and these other agents, this could count towards fellowship. we got the idea that we don't want to be confined to just the United States. We'd love to be international. We'd like to invite international members to become part of SUPS, and you always have been allowed to become part of SUPS, but now you can we're going to change the language of our bylaws to allow for SUPS members to form a chapter internationally. They can use the SUPS name. They have to interact financially on their own, but then they can become part of this sort of collaborative network, be integrated with an app, for example, and attend any of the meetings that we all have. And so it becomes a worldwide collaborative effort. This is just a simple message for me to say to SMSNA and out there that SUPS and SMA should be collaborative, not competitive. I feel that, politically in years past that may have been the case, but going forwards, I think it's the time where SUPS is such a surgical solution. It would fit nicely into the SMSNA puzzle. And I think that I'd like to grow SUPS. I'd like to see more members be part of it. I'd like to have a larger voice in the community for impact and maybe represent prosthetic urology at SMSNA, for example. I think it's okay for members to be part of SMSNA and SUPS. I certainly have for the last 12 years, so 15 years, so I think it's not onerous, and it allows me to participate in both organizations and advance the field forwards. So in conclusion, thank you for listening. I think the state of prosthetic urology is awesome. I don't think there's been a better time in the history to be a prosthetic urologist. We have excellent products. We have awesome economics. Challenges exist, but there's overwhelming optimism for the future of success. In my opinion, the IPP has begun to normalize. And I think the pipeline is awesome. There's EIPP, there's other products that are going to be out there in the future, but I think the field is like a big wave coming, and we just have to ride it, and it's going to be awesome. And I think SUPS is a wonderful organization for the advancement of prosthetic urology. It is the quintessential organization for prosthetics. I invite people to join, both locally and internationally, and I think we've got some really exciting new initiatives that we're trying to work on. So with that said, thank you for your attention, and again, I'm honored. Thank you.